7:39. Welcome back. 14th day of, I almost said May. It's been a long day, Dr. Kathie. Dr. Kathie Wuellner, Pediatric Healthcare Unlimited. My former doctor. I'm glad to have you in the studio. How are we this morning?
We're great. Thank you.
So with that being said, we've been having conversations with Centerstone about substance use disorder treatment programs, but we never really have the opportunity to talk about mental health, and to me, where it matters the most in our children and amongst our adolescent. And I'm really excited to have this conversation today, just speaking with you. This is definitely an issue that's hitting close to home.
Yeah, very much close to home, but nationwide as well. And people are wanting to blame the COVID crises on a lot of it. And it did have some, I think, impact, but we were seeing a ramp up of mental health issues prior to COVID.
Was COVID just the gasoline on the flame, maybe? Because I agree with you. I think COVID did take the blame for a lot of stuff, and these are things that we just kind of put the blinders onto until we had time to really process that.
Indeed. But things were already significantly ramping up prior to 2020.
And well, that's really fascinating. So with that being said, let's just start off broad with some statistics about some of the mental health and suicide amongst children and teenagers.
Okay. So when we talk about kids, the statistics are somewhat broken up into a couple of different patterns. So in general, when you look at the broad range of kids from like 3 to 17 years of age, the major mental health issues are attention deficit and hyperactivity disorder, and it's felt to be about 10% of that population, or about 6 million they're estimating. And this figure, mind you, is from 2020, so it's not even the latest.
Oh, wow.
Anxiety is the second leading mental health issue, but it's right at about 10% as well in that age group. And then we have the behavioral disorders, which seem to be more rapidly increasing, and those are starting at very early ages, truly the 3 and 4 year olds.
Wow. Well,
very much.
And what do you attribute that to? Those is it something that's always been there and we just never really collected the data, or is it truly an increase?
I think it's truly an increase, and I think part of it is that as families become more busy, have less time to contribute quality family time, that has an impact. We also know that the amount of nurturing that an infant gets in the first several months of life from their moms or from their surrogate mother has a very important role on the development of their mental health going forward.
Wow. That's very fascinaning.
Truly. Yeah. And it's something that many people don't even think about or take into consideration. And then single parent families, just lack of support, socioeconomic status amongst a lot of people dropping, that seems to have a positive or unfortunately negative role to play as well. And then family medical history also is contributing as well, so that we're seeing kids with behavioral problems, a parent or both parents had histories of that as well. So as the population is expanding, I think there's an increase secondary to that as well.
Well, and that's really fascinating to me because, there's so many, when you say 10%, I mean, 10%'s a very large number. That's not just, 10 out of 100, that's very large. And whenever we're talking about some of these causes, I think a lot of it, to me, it just is the fact that we're living a double life in a lot of terms in our social media, with our children. We're seeing all of these cool things and we're traveling on private jets, but none of that's really real. And it creates this false fantasy, really, that I'm seeing a lot of children live.
Extreme. Yeah, definitely.
And then what are some of the other causes and contributions, do you think? We know talking about the home, but is school a factor in this too, some outside interference, or is a lot of it internal in that home life balance?
Home, I think, is the starting point, but once kids get to school, unfortunately, the school environment for a lot of kids has become a very negative place as well. And there's more bullying that I feel is going on these days. Much of it is not reported, but I know just from my experience over the past 10 to 15 years of seeing patients, it's becoming more of an issue. And it seems to be more amongst girls, more so than guys. And it just seems that girls are just becoming meaner over time.
That is interesting, because for a while, wasn't it kind of the boys were more of the more aggressive or mean?
I think so, yeah.
Really, this really is.
And girls are becoming more aggressive these days.
Wow. And now, the one thing that parents, I feel like, have trouble with is because we're with our children so much, sometimes they chalk it up to maybe it was just a bad day at school, a bad week, or maybe these things haven't been the best, or, they have some problems in their personal relationships, so there's not a lot of attention being paid to that child, that what they're going through. Are there warning signs for this for parents to take an eye out for?
There definitely are. And like in younger kids, an increase in tantrums, a major upward rise in their degree of irritability, sleep issues at night, either not sleeping very well at all, and or sleeping way too much, performance at school dropping, grades dropping, not wanting to go to school. That's a major complaint that we frequently will hear. Can
I stop you real quick on
Sure.
that one? Whenever a child says, I don't want to go to school today, or there's, maybe faking sick, or, we all have done I flushed it, you just didn't see, I threw up,
Correct.
Now, for a parent, when you hear that the first time, maybe the initial thought is, all right, get up, you're going to school.
Indeed.
But when you hear that a couple of times, what should that conversation from that parent to that child be? Because you should know at that point, there's something more to this. But what's the best way to have that conversation without making your child feel like we're attacking you and there's something wrong with you?
Right. Basically, things to ask your child would be, well, tell me why you would like to stay home today. Do you have a big test today at school? Is somebody bothering you at school? Questions like that will help the parent try to seek out reasons why or what is going on at school is a reason that their child is not wanting to go.
Really fascinating. And then, I didn't mean to cut you off. Is there other warning signs to look for too on top of that?
Yeah. So in older kids, an expression of, I just don't feel I'm good enough. I'm trying hard, but it just doesn't seem to be working. Also, a change in their friends, meaning like they have decided to not have friends anymore, staying in their rooms much more often, coming home from school, going to bed, not wanting to get up and eat with the family, not wanting to partake in family activities anymore. Parents finding evidence of alcohol or other drug usage, which is something new for them. Poor sleep habits, and many things.
What I find fascinating, too, is when I'm hearing some of those things to look for, like you said, or we said a couple of minutes ago, the first time, it happens, you go, okay, something's up. But a lot of times do parents think, well, this is just them going, if they're adolescent, is this just them going through, the change of puberty? Is that so much of a red herring sometimes, where they see that and go, oh, it's just that, they'll be fine in 2 months?
Yeah, I think if it's a sudden change, it's really something that needs to be paid attention to and looked into.
Man, I'm loving this conversation, Dr. Kathie. We're doing some great work here. It's 10:49. I do got to pay one last bill of the hour, but we'll come back with Dr. Kathie Wuellner, Pediatric Healthcare Unlimited, and we learn more about child and adolescent mental health right here on RiverBender.com.
When I got in the car accident at the ER, they gave me a prescription of hydrocodone, and over time, it took more medication to mask the pain. I moved over to drug seeking and found heroin and fentanyl. I went to the Centerstone rehab facility, and it was the best decision I ever made in my life. I have my own car, I have a job, there's nothing holding me back anymore.
Dream Home Realty Center.
Hey, Sherry, talk to me, Dream Team.
We've got Joey.
Whether you're a seasoned pro or a weekend warrior, gear up with Falcommit and elevate your hunting experience. From rugged gear for the seasoned hunter to adorable outfits for the little ones, we've got your whole family covered. Literally, because the best moments are made in the great outdoors. And with Falcommit, you're not just wearing gear, you're wearing the stories of your adventures. Discover the joy of hunting together. Visit FAAP and outfit your family for the next generations of memories.
We are Phillips 66 Wood River Refinery. We make the fuels that take us to work and our children to school. We make materials and energy products that allow us to stay connected to each other. We care about the quality and safety of our products because we care about the communities we share. Our employees live our values of safety, honor, and a commitment to act as good neighbors where we live and operate. We are Phillips 66. When life throws unexpected challenges your way, you need a versatile legal ally to protect you. Sean Lentz, with over 12 years of experience, is here to help you in a variety of avenues. From personal injury to criminal defense and even semi-truck accidents, Sean Lentz has your back. Don't wait for the justice that you deserve. Call 618-465-8000 and see how Sean can help you today.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
They'd be your partner, they'd be your partner, and you're so vain. You probably think this song is about you. You're so vain. I bet you think this song is about you. Don't you?
We always have a better segment when the microphone's off, you know? 10:52, welcome back to this 14th day of March. It's Pi Day. You know, I'm not a fan of Pi Day. You know, I like Stone Cold Steve Austin Day, you know, 316 Day, love it. You know, as we're getting back to this, Dr. Kathie, it's such an important topic, and whenever I know how busy you are, and so to devote your time, it shows to me that there is a need to get this information out there, and parents do need to know this. And let's just go right back into the list, because you know, we always know about Centerstone and all these other organizations for older adults, but for children, are there very many treatment opportunities out there?
So Centerstone does do pediatric counseling as well. Unfortunately, the wait lists to get in are very long. And unfortunately, as with many mental health agencies, there's a fairly high turnover rate. So a child might be able to see a therapist one time, but then that therapist leaves, and then they have to be reintroduced to a new one, which might be several months before the next counseling session. And typically, counseling sessions should be taking place at least on a weekly basis. But for people who don't have regular commercial health insurance, the wait getting into a mental health agency, Centerstone, Southern Illinois Healthcare Foundation, it's 6 to 9 months.
But that's not even a viable number. I mean, because in 9 months, especially if that individual's really in turmoil, who knows what tomorrow brings, let alone 9 months from now.
Very much. It's extremely frustrating.
Well, and then on the parent side of things too, when we're talking specifically for children and adolescents, I mean, that's another 6 to 9 months of just trying to deal with what you can and handle it day by day, and that puts weight on the family.
As well as the school system as well.
Yeah, I didn't even think about that, because they're still having to go to school, and they're having those issues in that environment, and then putting all others at risk potentially too.
Indeed. Yeah.
Wow. And in terms of the state, the state of Illinois, what are they doing in your opinion to help the treatment, or maybe help raise awareness, or maybe even help fund some of the treatment of the children and adolescents in this crisis?
So, in 2022, Governor Pritzker created a children's behavioral health transformational evaluation. The results were put out about a year ago, and a plan has been laid out to...
Wow.
It's been laid out. Unfortunately, we are not seeing any of the effects at this point yet. But it's to try to provide a more centralized location where parents can go to get mental health support for their children, to increase mental health services, not only with counseling, but with more psychiatric beds, more residential care centers for kids who need more long-term psychiatric care. Mm-hmm. But I think that's several years off before we're going to see a true realization of that.
Currently, right now, what is the normal procedure for a child? Because I really don't know about this too much.
Okay. To be evaluated, or
the whole to be evaluated, we'll start with that first.
Okay. So all pediatricians are now starting doing the well visits on a yearly basis at age 15. We do a depression questionnaire and truly find out some important data when we do that.
I bet.
Yeah. And so there's screening procedures in place. And then in terms of treatment, counseling is first and foremost. When that's not readily available, we do have some books that we recommend to parents that they can work with their kids. Mm-hmm. For teenagers who have phones, there's some great apps that help with mindfulness, stress release, that type of thing. But they still don't replace what counseling can provide.
100%.
Yeah. And then there's medications also too. And when we decide when a medication is needed, is when that degree of anxiety or depression or whatever other mental health illness is present at the time. If it's impacting on their daily life of school attendance, job performance, school performance, family interactions, then we oftentimes will recommend medication.
And with that too, the medication, I'm sure whenever you start that process, it could be an up or downhill battle, it seems like, because some medication might work for some, and others it might be a different dosage or maybe a different experience. What does that look like as you're trying to figure out what would work best for that individual in terms of medication? So
follow-up, we try to make, and there's guidelines for treatment and follow-up, but initially, if we do start a medication, we'll have them come back in a month, make sure that things are better, make sure that they're definitely not any worse. And a lot of times, parents can start to see a little bit of light at the end of the tunnel. And so we might maintain a dose, we might take it up, and then routine follow-up is usually like every 3 months sometimes closer if needed. And then once someone is stabilized, we space it out to like 4 to 6 months.
Really interesting. And now, in terms of the parents' involvement in this, this is a journey, and you're walking through this with your son or daughter, whoever.
Right.
Whenever they're on this journey, what are some of the tips that maybe you could provide a parent right now about maybe that positive encouragement with because sometimes a kid might say, "Gosh, you've already asked me that. I'm fine. Leave me alone."
Right.
But how important is it to still make sure, hey, I am talking to you because I care about you, I love you? What are some tips that you can provide for that?
So indeed, basically just what you said is very important. Look, I really love you. I care about you. Please don't consider this a nag kind of
Right.
thing. But just being there for all of their activities, go to their sports events, go to their theater events, try to take them out, do special things with them. Just be a good parent.
Mm-hmm. And in terms of because I know a lot, and this sounds wild to say, I know a lot of children that are 7, 8 years old that have social media, and they have all of these accounts and everything else. To me, I just don't see that as feasible. But for you, you're the professional in this, and I'm just the guy blabbing into this microphone. How important is it, in your opinion, to limit that screen time or maybe limit apps in general? Is that an important issue, or is that just me creating an issue?
No. Apps in general are creating, I think, a major important negative component to mental health. Mm-hmm. And I would strongly encourage parents to hold off with cell phones, with apps, until maybe high school. Mm-hmm. I understand that some parents need contact with their kids, so buy them a flip phone that don't have any apps on them.
Yep.
But I've had multiple experiences with patients at 10 and 11 years of age who already had pretty horrific experiences from apps, from sexual connotations to here's a way to kill yourself kind of apps. So parents need to really know what their kids are looking at. And parents think they might have controls on, but there's ways that kids finagle around them. And there's some very disturbing apps that are out there. And then the algorithms that just the general platforms of Facebook and Twitter and Instagram and Snapchat, et cetera, use. Once a child goes and looks perhaps at a depression, or, maybe I'm thinking about suicide, then that's what they keep getting fed
Right.
over and over and over. And it almost just becomes a reality to the kid, like, oh, okay, this is okay.
Is self-diagnosing happening on social media too with children? Because and the way I mean by that, if I need to clarify for the audience, is, sometimes there's folks that talk about maybe a symptom or a disease or an ailment they have, or maybe a mental ailment that they're battling. Do children sometimes watch that and go, oh, I do the same thing and I have that too?
They do, but not very often.
Okay.
That normally is not what brings a kid in to the office.
That's what I was curious about. And I mean, we've been talking for almost 30 minutes now, and I just can't believe how much I've learned about this. And, what's the best way, Dr. Kathie, for parents to learn more information? Is there any websites that you can give them, or any other maybe just URLs, links?
Okay, so the American Academy of Pediatrics has a great website that people can go and get mental help information. The CDC, the Center for Disease Control, also has a lot of information on that as well. And then just Googling can get you to some really good sites as well.
Absolutely. And Dr. Kathie, I've loved this conversation. You are welcome back for more of these, because they're so important for the audience to really learn more about, and especially because so many parents don't know what to do. And that's what I'm starting to understand too. You're meeting with them a lot. Is that kind of the case?
Indeed. Yeah. And I guess the one other thing that I really want to point out to parents is that we look at teenagers as young adults. And that's the group that has the highest rate of suicide. And in fact, between 15 and 19-year-olds, it's the second leading cause of death in that age group behind automobile accidents. The driving force behind that is that we think of them as young adults, but their reality testing, the center of the brain that's called the precortex area does not fully mature until the early 20s. So reality testing doesn't really come to fruition until sometimes early 20s. And kids, as teenagers, act more on impulse. And when you act on impulse, you end up doing some pretty crazy things sometimes.
100%. And Dr. Kathie, thank you so much for your insights today. And I do want to highlight that I got the best care at Pediatric Healthcare Unlimited over there at 4 Memorial Drive. And you guys do a fantastic job. And I know so many people that still utilize you guys and just can't get enough out of it. And thank you so much for bringing us your insights today.
My pleasure.
With that being said, I'm overtime. Boss, you're getting charged for another hour. 11:05, that's the time on a Thursday morning, but I'm out of here. So thank you all so much. Thank you, Dr. Kathie. And we'll see you again tomorrow for sports and all the gamut of conversations that are going to be hitting you here in the heart of the 618. On that note, enjoy your day, grab your umbrella, and try your best to stay out of jail.
He said it would.